Here we have a case of a 19-year-old male was requested to do HRCT and paranasal sinuses. Once a pulmonologist or a physician asked for both together, so he has in mind the sinopulmonary infections. So in your HRCT reporting and paranasal sinus reporting, you have to be up to his thoughts. Sinopulmonary infection are 4 entities: primary ciliary dyskinesia, primary immunodeficiency, cystic fibrosis, and Young syndrome. As you see here, we have lower lobar predilection for 3 in bud, branching opacities, mucus plugging. We have bronchial wall thickening, bronchial dilatation, yet no obvious bronchiectasis. We have to be conservative in description of bronchiectasis. We limit this description in bronchi with lost tapering. Until now, these are signs of infection. You shouldn't be just mentioning the infection as everyone can diagnose this as infection. The point is that you are thinking of what is underlying. Presence of bilateral, lower lobar, right middle lobe, 3 in bud, bronchial wall thickening, bronchial dilatation, mucus plugging. This should highlight in this age, especially if it is repeated infection, that there is something underlying to cause this repeated infection, particularly when paranasal sinuses are requested. And even without PNS request, these 3 entities should be in differential diagnosis. Why we excluded cystic fibrosis? Because cystic fibrosis has predilection for upper lobes. This is the coronal reformat, nicely showing the lower lobar predilection of bronchocele, 3 in bud, bronchial wall thickening, and bronchial dilatation. This is this paranasal sinusitis, the other part of the sinopulmonary infection. We have chronic sinusitis with mucoperiosteal reaction, with newborn formation in the right maxillary base. We have frontal sinusitis, ethmoiditis, and both maxillary sinusitis. This is the coronal reformat. Showing the chronic manifestations of sinusitis, the high density within right maxilla, highlight for fungal infection on top. So the aim of this case, that sinopulmonary infection has reasons to be mentioned in HRCT. If upper lobes and this appearance, your diagnosis will be cystic fibrosis. Lower lobar predilection, you have 3 differentials. Primary ciliary dyskinesia, because no dextrocardia to be Cartagner at that time, it will exclude the primary immunodeficiency and Young syndrome. The levocardia and normal situs for the patient. So we have 3 differential: primary immunodeficiency, primary ciliary dyskinesia, and Young syndrome. And thanks for your attention.